The beginning was scary. It was scary.
This is something that was unexpected, something that we were not ready for, something that we did not know how to handle.
You would go to bed one evening and what you thought was medical practice or fact at that time, when you woke up in the morning, was no longer the case.
The biggest scare that I've had is not only getting infected myself, but who can I get infected?
What is awful about this disease or this condition is that you are afraid of everyone and everyone is afraid of you.
You always know that, like, okay, whatever comes in this door, we're gonna have to take care of it, but there's nothing else, there's no other option, so we'll make it work somehow.
I am Dr. Maria Franco, and I am honored to serve as president of the medical staff at Nicklaus Children's Hospital. As the year began, none of us imagined our community would become an epicenter of a fast-spreading global pandemic. It has been a turbulent year, as we have worked together to adapt to ever-changing guidance and circumstances. In the beginning, there was tremendous uncertainty for all of us, and fear. We all had fear. Could we keep one another safe as we met the needs of our community? Could we protect our families at home as we fulfill our calling? Each day, we overcame these concerns to serve those who look to us for hope and healing. And we did it. This is the art of medicine.
The COVID-19 pandemic has tested all of us in ways we have never previously imagined. Dr. Franco and I are honored to have worked with an entire team of doctors who have been steadfast in their commitment to putting patients and families first, even in the most uncertain of times. It gives us great pleasure to introduce some of our Nicklaus children's physician heroes in this video. Each tells a piece of our collective pandemic story. Together, these stories become our story of courage, caring, and collaboration. We extend heartfelt appreciation to all our Nicklaus children's physicians for all you do now and always for the children of our community and beyond. Thank you.
At the very beginning, it was this overwhelming sense of fear of like what to expect and how do we do it and what's gonna happen. Are we gonna get this tidal wave of sick patients? Are we gonna get sick? Are all of our colleagues gonna be, dropping like flies? And how do we take care of ourselves and how do we keep our patients safe from other, being exposed from other patients?
Being in the emergency department, we're considered the front line in this pandemic. My team and I were there from the beginning, 24 hours a day, 7 days a week, without knowing what really was going to come through that door. We had been hearing news stories from China and from Europe about the infectivity of this disease, and we weren't sure what to expect in the United States at that point.
For the first time in my career, I was faced with something that was not only unknown, but that I also felt like I was vulnerable to. People were afraid. My team, they were afraid of handling this. They were afraid of getting sick. They were afraid of not having enough protection, enough PPE to go see the patients.
You look into the news and you see how many healthcare providers were affected by this virus. That's very, very scary. But I understood that this is something that is happening to all of us, not just our patients, that everyone is at risk.
Initially, the biggest stress was not to have tests for everybody. That was the biggest stress that we had. Afterwards, then you look and you say, how are we going to treat these kids' IV fluids? How are we going to treat the medications? Each thing you needed to have a certain very specific answer as to when to do it, how much to do it, when was the right time, what were the possible side effects. So we had to go through all of that.
People were coming in panicked, a lot of them. I had a family that got on their knees crying, please test my child, please test my child. I think he has COVID and he's gonna die. Where the child wasn't even that sick, but people were scared. I think the whole nation was scared.
Being infected myself and maybe transmitted to other people who were maybe more vulnerable than me was probably my biggest scare at the beginning. Of how much did I really have to stay away from my children. Both myself and my husband are physicians, so there was no way I could give my children's responsibility to somebody else. It was both of us. In terms of being a physician, I think we're used to having a little bit more control of the situation, and at this point I think there was so many unknowns.
You have to realize that when you do infectious diseases, from the very beginning, you realize that at some point, you're going to be in the middle of an epidemic and you're going to have to handle it. You're not going to have a choice. We did not plan to have something so big happen so quickly. What we did very early, we got a committee together. We got a committee that we called the Clinical Pandemic Ad Hoc Committee, and we started meeting every day.
You go back to basics. You go back to what you learned in med school. You try to investigate the situation, see how can you approach it, what are the resources you have available to that situation, and then you handle the best you can. What we decided to do from day one is be transparent as possible with everyone in terms of what do we have, what do we expect to have, what are we doing, and why are we doing what we're doing.
It's a teamwork. Our nurses, nursing leaders, us together with administration and then infection control, and then many other people in the hospital really who were excited to actually to create a COVID area when we flouted the idea, and then within a couple of days it came to fruition. Really, there was so much of enthusiasm among every team member. Within 2 days we actually created the functional unit to take care of these patients.
There was a lot of communication in between us. Of course, everything had to be virtual because in person was completely discouraged. So a lot of Zoom meetings, a lot of back and forth texting, a lot of conference calls. Because as things changed, we had to keep everybody up to speed of what was going on and what things needed to be changed in the way we were managing patients, in the way we were using PPE, in the way we were deciding where or how to admit a patient or which patients needed to go to the ICU and which patients could stay on the floor.
We had realized that the best way to actually deal with this situation is one, to anticipate problems and challenges and come up with a plan for them, and then be adaptable to respond to the changing dynamics of the pandemic. So we have a group of physicians. It's a multidisciplinary type of group. So every week we would meet as a group of physicians, nurses, all staff essentially, to review the data as it came, and then to come up with protocols to help inform the rest of our teams on how to manage a patient that may be infected.
In pediatric critical care, we're very hands-on. We're next to the patients, multiple times a day, and I think this was a little unsettling because we're now sort of in a situation where we're having to develop new processes to care for children. We want to be mindful of exposing the rest of the unit and the rest of the patients and the rest of the care providers to the virus.
We expected that a virus was going to bring more people to us. We never expected that people were going to be afraid of coming to us. And we have had to change a lot of things to show the families that coming to us is safe. So a lot of times I'll go into a room wearing my shield and everything, and I come in and I tell, after I say hi to the families, I'll say, I'm coming from outer space. So that's the way I'm dealing with it, to show the children, don't be afraid of me, because I'm wearing all this equipment. And at the same time, I'm telling the parents, I am sorry that I'm wearing all this, but I'm doing to protect me and you.
My kids are little. My 9-year-old sort of gets it. My 4-year-old doesn't at all. And my 6-year-old is somewhere in the middle. It was a very strange experience to all of a sudden come home and have them run to me at the door and then remember that they weren't allowed to touch me and they couldn't give their hugs until mommy took a shower and, took all of her scrubs off and everything. And I think the first couple times that my 4-year-old halted in the hallway it's heartbreaking. One of the saddest, though, is that my daughter, even though I think she gets it more, she holds it in more. And I saw a note that she wrote one night, like in her little, it's not really a diary, but in her little journal, that said something like, COVID is the worst, and I really hope my mommy and daddy don't get sick at work. And that kind of broke my heart.
It has been very difficult not to be able to talk to some of the people that I love. I have family members that are, that have chronic illnesses, that are immunocompromised, very close family members. I can tell you that I haven't seen them for many months, even though they live close to my house. I haven't seen them for many months because I'm afraid to, even though I don't experience any symptom, maybe being a carrier of the disease and passing this virus to my family.
I have 4 children at home, and you try to distance yourself from your family when you do come home. You know, my whole thing was I needed to get home, get into the laundry room, take all my clothes off, shower, completely disinfect myself before I even saw any of my family. And in addition, I have 2 elderly parents that live very close to me, who my mother used to come every day. They're 85, both of them, and my father has Alzheimer's, and they used to come every day to see the kids, and I told them they couldn't because of my job. So it was tough. You know, I couldn't see them.
We thought that we were not here alone dealing with this virus, and the collaboration with other hospitals would be something that would help us dealing with this pandemic. So we reached out of different children's hospitals in South Florida, and we started having meetings and sharing experiences among us and learning from what other places were doing and sharing protocols, and that worked very well.
We were fortunate that the physicians up north were very, very generous, sharing their experience, sharing their knowledge, because by the time we were bombarded with the patients, we were pretty much prepared for that, and that took a lot of effort, a lot of hours of meetings that we stay away from our homes, our families and patients to prepare for that.
As we get more knowledge, we get more of that sentiment that we can actually deal with this and that there are ways to prevent other people from getting infected from us, which is really what worries us the most.
Despite all the challenges and the issues that we've had with this pandemic, I think globally it forced clinicians to think about patients not as individuals only, but as part of the population, and to provide the type of care that we need to treat the patient and the population that they're part of.
I mean, we've seen it all around, like how the city rallied around people, and how, like, at the beginning of all this, like, we were getting like food deliveries to say thank you from people, and not that like we needed the food or anything like that. It was just so nice to feel like everybody was in this together, like we can overcome this, we can get through it, kind of thing. And it does feel good, at least from that standpoint.
So one of the best things to come out of this whole experience is actually how we prepared for this unknown stuff. The key thing is to have a good leadership. Second thing is to have a team, and then involve every team members into that. Because what we found amazing stuff is the people, they were anxious, but they came through. They came with a lot of innovation. And then thank God, if you look at last 6 months experience, we have not had one single intra-hospital transmission. What we have experienced here for this can be a blueprint for really if any other challenge comes to the hospital or the community there.
We now have new processes, new procedures. We're very solid in our flow trees of how we take care of these COVID patients, and I think we're ready.
At the end, you do learn a lot from having to deal with a situation which is not usual, and the way that you deal with it makes you better.
It reminds you that it keeps you humble. It reminds you that there's so much we just don't know.